Hello, my name is Dr. Ru. I've been an associate dentist at Secure Dental for 7 years, and I'm here to answer some questions today for you. So wisdom teeth are also referred to as third molars that are the last teeth to develop and grow in our late teens and early 20s in the hindmost part of our mouth. Wisdom teeth should be regularly evaluated and monitored for proper eruption, and if there are signs of ectopic growth and development, then they're advised to be removed. False. Not everyone does. Most of them do, but some people will not have them at all. And some will have 1, 2, 3, 4. I've seen as many as 8 wisdom teeth, yes. But not all of them. Some patients may be lucky to not have them at all. No, not necessarily. If they grow and erupt properly in the right position, and the individual's anatomical features in the mouth can accommodate them with enough space without hindering their ability to clean thoroughly the area, then no. Absolutely not. With proper post-op care and compliance, it should be pain-free almost every time. No, there are no major food restrictions as long as certain post-op protocols are followed as directed. So implant maintenance is the same way you would with your natural teeth. It requires the same brushing technique, and we would advise the patient to come in for regular recare visits for monitoring and follow-ups. So we start a full arch dental implant process for our patients through customized treatment planning for every patient to plan for both the surgery and for the restorative part for final prosthesis. All implants are generally placed on the same day of the surgery, and some form of temporary prosthesis will be placed within a week until the final prosthesis is placed after a certain amount of healing time. As soon as the same day. It depends on every patient, but we usually offer and service a temporary replacement on the same day as well. A sinus lift is also referred to as a maxillary sinus bone augmentation. It is a surgical procedure that increases the height of the upper jawbone to accommodate dental implants. So it happens a lot with patients who have been missing upper molars for quite some time. For our diabetic patients, it is still advised for most of our diabetes patients that are well controlled. We offer consults to plan options to properly condition our patients to get dental implants. So the main things that we're concerned with when it comes to diabetes is delayed healing, and they're more prone to get an infection. So we try to educate our patients and manage them in a way where things will be ideal during and post-surgery. As far as the longevity of dental implants go, I have personally experienced seeing one of my mentors, 30-plus-year-old implant that is still up and running well. So it can actually last a lifetime if they're properly managed and maintained. So an overdenture and fixed full arch are very similar in a sense that they're both implant retained prosthesis, but overdenture is a semi-removable snap-on dentures. So they still are dentures where we apply snap-on inserts. They'll snap onto the implants. So they're rigid, they're very stable, but they are still removable at the end of the day and require your maintenance to clean them on a daily basis. Versus a fixed full arch prosthesis is a somewhat of a permanent fixed form of a prosthesis that we screw on to the implants, and it requires less maintenance from the patient's end. They just need to come in regularly for periodic recare visits for us to take care and maintain it for them, and it doesn't have to be removed. It'll be fixed in the mouth. So the main difference between a resin fixed full arch and the zirconia fixed full arch is in the material. So the resin FFA, we use more of a temporary prototype, more of a doorstep to get our patients to get the final zirconia metal, which is more strong and rigid. So one of the most difficult cases I've done was on an elderly patient with severe bone resorption and limited mouth opening. It's one of the tougher cases that I still remember, but we were able to regrow the bone and place stable implants, and she's still doing fine with that. I have had a really difficult patient who we couldn't really get the right treatment plan for the patient, and he was very indecisive when it came to it. So we started off with an overdenture, which is a snap-on denture. So we ended up placing 4 implants on the top and 2 on the bottom. But he didn't quite like the process, and he didn't quite like the fact that it was still removable. So we actually ended up placing a few more implants, and we gave him a fixed full arch, which he was happy with.